What other conditions are associated with a higher degree of developing skin cancer? In today's world, we have lots of transplant patients, either heart transplant patients, kidney transplant patients, we have lung transplant patients, we have bone marrow transplant patients. Transplant patients all are at much higher risk for developing skin cancer. If that transplant patient has had a history of chronic sun exposure and previous skin cancer before their transplant, after they get their transplant, that incidence goes very, very much higher. So those patients need to be very, very careful. Actually, we recommend a pre-screening even before their transplant, and then after they've had their transplant, they need to be checked at least every 6 months, definitely once a year, but probably every 6 months. Patients that are on medications that cause a decrease in immunity, patients that are on prednisone, patients that have other immunocompromising conditions, those are patients that also must be followed a little closer because they are at much higher risk of developing skin cancer. I think it's important for not only dermatologists, but doctors in general and relatives of family members that have had transplants to make sure that they get their loved ones in to be checked periodically. If a transplant patient develops an aggressive squamous cell carcinoma, mortality rates are 100%, meaning you'll probably die of that before you die from complications of your transplant. So it's really, really important to get those patients in quickly and for them to be monitored aggressively by a qualified dermatologist that really understands how to detect skin cancer and treat skin cancer.